Abortion. It is a procedure to end an pregnancy. It is also sometimes called termination of pregnancy. The pregnancy is ended either by taking medicine or having a surgical procedure. So, how to get an abortion? Abortion can be carried out under the care of NHS hospital or a licensed clinic and are usually available free of charge on the NHS. There are three main ways to get an abortion on NHS. The first one is you can self-refer by contacting an abortion provider directly. That is called BPAS, NUPAS, or NHS local sexual health website can tell you about eligibility and services in your area. The next one is speak to a GP and ask for a referral to an abortion service. The GP should refer you to another doctor if he or she has an objections to abortion. The third one is contact a sexual health clinic, sometimes also called a family planning or a GUM clinic, genitourinary medicine, and ask for a referral to an abortion service. The waiting time can vary, but you should not have to wait more than 2 weeks from when you first contact an abortion provider to having an abortion. So you can also pay for an abortion privately, that is not in NHS, if you prefer. The cost for private abortion vary depending on the stage of pregnancy and method used to carry out the procedure. When an abortion can be carried out. Most abortion in England, Wales, Scotland are carried out before 24 weeks of pregnancy. They can be carried out after 24 weeks in very limited circumstances. For example, if the mother life is at risk or the child would be born with a severe disability. Most abortion service will ask to perform an ultrasound scan to work out how many weeks pregnancy you are. The length of pregnancy is calculated from the first day of your last period. The abortion are safer the earlier they are carried out. Getting advice early on will give you more time to make decision if you are unsure. Deciding to have an abortion, the decision to have an abortion is yours alone. Some women may be certain that they want to have an abortion, while others may find it difficult to make a decision. All women requesting an abortion can discuss their option with and receive support from a trained pregnancy counselor if they wish. Impartial information and support are available from your GP or another doctor at your GP practice, a counseling service at abortion clinic organized such as Brook, that is for under 25 years, and BPAS, MSI Reproductive Choice UK, and NUPAS, NUPAS. You may also want to speak to your partner, friends, family, but you don't have to. They don't have to say in your decision. If you do not want to tell anyone, your details will be kept confidential. And if you're under 16, your parents do not usually need to be told. The doctors or a nurse may encourage you to tell the parents, carer, or other adult you trust, but they will not make you. uh, there are organizations usually known as a crisis pregnancy centers that offers counseling around pregnancy. They do not refer people for abortion and may not offer balanced or accurate advice. If you go to a place that offers pregnancy counseling and you are not sure if they will refer you for an abortion, ask if they refer people for an abortion. What happens during abortion? So before having an abortion, you'll have an appointment to talk to about your decision and what happens next. Whenever possible, you should be given a choice of how you would like the abortion to be carried out. There are two options, medical and surgical. In medicine, that is also called the abortion pills can be taken. You take two medicines usually 24 to 48 hours apart to induce an abortion. In surgical abortion, a procedure to remove the pregnancy and normally go home soon afterwards. After an abortion, you will probably need to take these things for a few days. It is likely to have some discomfort and vaginal bleeding for up to 2 weeks. What are the risks of abortions? Some of the Abortion usually is a safe procedure, and abortion are safest and happens with less plain bleeding when carried out early as possible. And there are some small risks of complications like infections to the womb, that is uterus, and some of the pregnancy remains in the womb, except bleeding, damage to the womb or entrance of the womb, that is cervix. If the complications do occur, you may need to further treatment, including surgeries. Having an abortion will not affect your chance of picking pregnancy again and have normal pregnancy in future. You may also able to get pregnant immediately after your abortion. You should use contraception if you do not want to get pregnant. So these are the things that I would like to discuss. And an abortion can be only be carried out under a care of hospital or licensed clinics by qualified doctors. If you are less than 10 weeks pregnant and having a medical abortion, the hospital or clinic can usually give you a second dose of medicine to take at home. Most people having an abortion do not usually need to stay in the clinic or hospital overnight, but you may need to go to appointments on different days. So before abortion, they will have some assessment with you, and during the assessment, they will discuss the reason for considering abortion, whether you are sure about your decision, and be offered the chance to talk things over with a trained counselor. If you think it might help, you can talk with the doctor, nurse about the method available, including associated risks and complications. And then it will be offered with an ultrasound scan to check how many weeks of pregnant you are. They will offer some STI testing also, and they will be doing some blood tests depending upon the medical conditions and you have and stage you are at in the pregnancy. And after you are sure, they'll you'll have to sign a consent or form, and the clinic or hospital will arrange a date for the abortions. So methods, I have already explained about the methods. Medicine, I have already explained about the medicine that should be taken, and the tablet name is called mifepristone. This blocks the main pregnancy hormones. The first tablet is taken in the hospital, and the second tablets can be taken at home. And okay, and these tablets can be swallowed or also can be kept inside your vagina. Any of those can be done, and this is done. This is taken if the pregnancy is less than 10 weeks, uh, and within 4 to 6 hours of taking second medicine, the lining of womb breaks down, causing pain, bleeding, and loss of pregnancy. But sometimes you need to take more dose of misoprostol to get the pregnancy to pass. Occasionally, pregnancy does not pass and operation is needed to remove it. The operation I have mentioned about, first of all, local anesthesia is given to numb the cervix, and conscious sedation, we call it, where you're relaxed but awake, and in uh, deep sedation or general anesthesia also can be done. Three things can be done to numb the place. And most people will have deep sedation will not most people with having deep sedation will not remember anything and will not be aware during the operation. And there are two methods of surgical abortion: vacuum or suction aspiration. This can be done up to 14 weeks of pregnancy. A tube is inserted in the womb through the cervix, and the pregnancy is removed using the suction. The doctor may need to use a special instrument to help the removal of pregnancy depending upon the how many weeks of pregnant you are. Vacuum aspiration takes 5 to 10 minutes and most will go home a few hours later. And dilatation and evacuations, D and E, this is usually done After 14 weeks of pregnancy, involves inserting a special instrument called forceps through the cervix and into the womb to remove the pregnancy. D&E is usually carried out under the sedation or general anesthetics. It normally takes about 10 to 20 minutes, and you are usually able to go home on the same day. And after abortion, you don't usually need to have an other test or appointment after a surgical abortion or a medical abortion in the hospital. If you have a medical abortion at home, you may need to have a special kind of pregnancy test or scan to make sure pregnancy has ended. If you have a medical abortion, you may have certain lived side effects from the medicine, such as diarrhea or feeling sick. If you have a surgical abortion, the general anesthetic and the sedation medicine can also have some side effects. From all type of abortion, it is likely you'll have some stomach cramp or pain, vaginal bleeding that lasts up to a week or two. Sometimes light vaginal bleed after the medical abortion can last up to a month. So after an abortion, you can take some painkillers like ibuprofen and paracetamol to help with any pain or discomfort. You can use some sanitary towel pads rather than tampons until the bleeding has stopped, and you can have sex as soon as you feel ready, but use contraception if you do not want to get pregnant again. And usually you will be fertile immediately after an abortion. You can usually return to normal activity as soon as you feel comfortable, uh, and when you can be, you know, you can go for medical help. You can get advice if you have severe pain, bleeding that does not get better in a few days, still feel pregnant after about a week. If you have a temperature or flu feelings or unusual vaginal discharge, this could be sign of infections. And have any other worries, then you can go to the hospital, and you can just contact your GP or call 111. And you may experience a range of emotions after an abortion. This is common. If you need to discuss how you're feeling, contact the abortion service or your own GP. They will be able to provide a counseling and refer you for counseling if you need. Buying abortion pills online. It is against the law to try to cause your own abortion. This includes buying abortion pills online. You'll not know if pills sold online are genuine, and they could be harmful. Before doing anything, contact an abortion advice service such as BPAS, British Pregnancy Advisory Service, MSI, Reproductive Choice, or a GP or a sexual health service who can help you find appropriate care for free and in confidence. And effects on fertility, health, and future pregnancy. Having an abortion does not increase the risk of breast cancer or mental health issue. Having an abortion will not affect your chance of becoming pregnant and having normal pregnancy in future. Many women are able to get pregnant immediately afterwards, so you should start using contraceptions right away if you do not want to get pregnant. The doctors or nurse at the hospital or a clinic should talk with you about contraceptions at the time you have the abortion. There are very small risks to your fertility and for future pregnancy if you develop a womb infections that is not quickly treated. The infections could spread to your fallopian tube and ovaries, known as pelvic inflammatory disease (PID). This PID can increase the risk of infertility or ectopic pregnancy, where and egg implants itself outside the womb. But most infections are treated before they reach this stage. Talk to your doctor or an abortion advice service for more information if you are concerned about the possible risks of an abortion. Hope this helps. Thank you.